Hi, my name is Chesney Welch, and I'm a student nurse at LSUA. I conducted a medication reconciliation on a 58-year-old Caucasian male who lives at home with his wife and manages his medications independently. This medication reconciliation was conducted at the client's home. To begin with his health history, 28 years ago, at the age of 30, this client was diagnosed with rheumatoid arthritis. He takes leflunomide or Arava, which is a disease-modifying anti-rheumatic drug, 20 milligrams once a day. He takes prednisone, a corticosteroid anti-inflammatory drug, 5 milligrams 1 to 3 times a day. Continuing with his medication history, 22 years ago, at the age of 36, this client had his first myocardial infarction. 1 year later, he had his second. In 2014, he had a third heart attack. In 2015, he had a fourth heart attack. Throughout the years, this client has had 11 angioplasties and 5 stents. The client is taking asorbitide ditrate or sorbitrate, which is a long-acting anti-anginal, 20 milligrams twice daily. He carries with him nitroglycerin, nitrostat, which is a short-acting anti-anginal, to take as needed for chest pain. The client is prescribed clopidogrel or Plavix, which is an antiplatelet drug, 75 milligrams once a day. At the time of his first heart attack, 22 years ago, this client was also diagnosed with hypertension and high cholesterol. To manage his hypertension, the client takes hydralazine, 100 milligrams once a day. Hydralazine is an antihypertensive direct-acting vasodilator. He takes amlodipine or Norvasac, which is an antihypertensive calcium channel blocker, 5 milligrams twice a day. He takes clonidine or catapris, which is an antihypertensive central-acting alpha-2 agonist, 0.2 milligrams 3 times a day. To manage his high cholesterol, the client is taking atorvastatin or Lipitor, which is an anti-hyperlipidemic statin, 80 milligrams once a day. After interviewing this client and going over all of his medications, the client is very drug compliant. He follows his medication regimen very, very closely. He is also very aware of the multiple drug-to-drug interactions that are possible with taking this many drugs. To help with that, he uses one pharmacy. That's where he gets his drugs from, one pharmacist. And he is very close with the pharmacist, and the pharmacist goes through his medications with him to list out or to eliminate any adverse drug-to-drug interactions. There were some safety concerns that I became aware of when I was doing the reconciliation with this client. The first one is this client is prescribed prednisone. He has been taking this drug for almost 30 years now, and his dose is 1 to 3 pills a day, and he has no concrete parameters from his physician. The way that he described it is, I've been taking this drug for 30 years. I know what my body needs. So he pretty much takes either 1, 2, or 3 pills a day, depending on how he feels. This could be an issue with dosing. He could be overdosing or underdosing himself. So my suggestion to him was to talk to his physician to get some more concrete parameters as to how many exactly, how many pills he should be taking. Excuse me. For his prednisone, rather than using his own judgment, because again, that could be a dosing issue. The second concern that I noticed after going through his medications with him, I was checking some of the expiration dates, and this client is prescribed nitroglycerin, nitrostat, which is a short-acting anti-anginal. You want to take that when you're having chest pain, and his was expired. The expiration for these are 6 months after opening, and these clients who are prescribed this only take them when they're having chest pain. So if they're not having chest pain, they're not taking these. They may not be aware of the expiration date. His nitroglycerin was expired, because he had not had to take it within the past few months, so it had expired, which that's a drug that we want at its 100% potency because we're giving it for chest pain. So we don't want to take it when it's expired. We want it to be very much potent. My suggestion to him was, since it's not a drug he takes every day, he takes it as needed when having chest pain, is when he opens this medication, go ahead and move forward 6 months and set an alarm either in his phone or use their calendar. They had a calendar in his kitchen, and write it down that he needs to be checking his expiration. He wants to make sure that drug is not expired and he's not carrying it around when it's expired. We want that drug to be at its 100% potency. The third safety concern that I became aware of was that this client only had the only medication list that he had on him was in his phone. And after comparing his phone to the labels on the bottles, several of the prescriptions were spelled wrong on his list in his phone, and some of the dosage was wrong as well. This is a major safety issue because there could be some confusion about dosing, confusing about which med it is, and if something should happen to his phone, there's no way for anyone to get that information. So I suggested to him that he get with his physician or his pharmacist to get a printout, typed up copy of this medication list of all the drugs that he takes, and either have that with him, keep it with his medications, keep it in his wallet. His wife could have a copy in case she needs something more physical rather than just a phone, because while the phone's convenient, something could happen and you wouldn't have that information. He needs to have that on his person. After discussing these safety issues with him, he did realize that having some of the misspelled spellings of the drug names and some of the dosages is very much a safety issue. He did say that the 6 months for his nitroglycerin was a good idea, so he was going to write that in his calendar so that he would know when to make sure he checks his nitroglycerin to make sure it's not expired. All in all, he was very compliant with his medications. He knew a lot about his medications and some of the side effects and why he was taking those. Like for his Plavix, he knows to watch out for, signs of bleeding and report those to his doctors. After compiling this reconciliation, I become very aware of all the day-to-day things that you may not think about performing an in-home reconciliation, whereas in the hospital setting. So this was very eye-opening for me. This concludes my medication reconciliation. Thank you very much.